Enrico Occhipinti from University of Milano. Enrico, I think you have just did the conference here about prevention. Can you explain just a little bit how was your conference?
My conference starts from the point that musculoskeletal disorders in Europe and in Spain too are the main cause of occupational disease. More than 60% of all occupational disease in many European countries are musculoskeletal disorders. And they come mainly from manual handling of loads, repetitive movements with the upper limbs, awkward postures, and so on. So we have the big chance to afford to evaluate the working condition for those risk factors, and also to try to prevent, because the costs are increasing and increasing for this kind of disease.
And what are the new approaches in this area?
From a lot of time we have developed methods for assessing the risk and how to address risk reduction. Those methods are not so easy because they should consider many factors altogether. And so one trend is now to try to simplify also for the use by non-experts. And we may simplify up to a certain level, but when you have simplified and you find some problem with this simplified approach, you go further with risk reduction, directly with prevention, without thinking to go in more detail for this risk factor, because it is time consuming and doesn't go to the main goal, that is prevention, reduction. In other cases, we have very complex lifting tasks or repetitive tasks that are mixed together during the same day. So we have new approaches for evaluating and then reducing the risk for this complex task. For instance, up to now we have methods evaluating a single lifting task, a single kind of lifting task. But in the most of the workplaces we have many kinds of lifting tasks all together for the same person. So we have found, together with Spanish and American colleagues, some simplification to afford those complex situations. And the last one is that we need now a so-called comprehensive approach considering all the influencing factors to musculoskeletal disorders, but most of all the political or the decision-making commitments to afford those pathologies, because they cost a lot to the society and to the companies. A single musculoskeletal disorder costs a company about 40,000 euros, a single case. Apart from mutuals or from the insurance, a direct cost for the company. So, in many cases, preventing is better for the workers, but it's better also for the economy of the company. And so a comprehensive approach is given. Now we are developing international standard we are involved in, just to give this idea of a comprehensive approach. And the first we have deal is for manual handling of people, of patients in the healthcare sectors, in hospitals. That is a big problem. A lot of nurses fell with disease or disorders, especially of the spine of the shoulder. And it's a good idea to manage this also for the quality of care of patients. But to do this, we need a policy by the companies, by the hospital, with teaching the nurses how to behave with different kind of patients, and not only to have hoists or simple tools to move the patient. It's a comprehensive approach, not only for solving the problem of manual handling by nurses, but to improve the quality of care. We have done a standard on this, and this by ISO, and this shows how from a problem of workers we can improve a system.
Okay, and Enrico, this is the 10th edition of the Congress ORP. Why do you think this Congress can be important?
Because it's a forum. It's a forum of many professionals with different point of view, safety expert, occupational doctor or ergonomist. They are put together facing the problem in Spain, but there are more or less the same in many European countries, and as far as I know, also in many South American countries. They are strictly connected with the OPC that assist to the ORP conference, also for the connection with the ORP in Chile.
Yeah.
And so there are a lot of things that could be changed, an idea to put them together, and each one gives his contribution to try to solve the problem. So I'm very happy when I'm here, because I met not only ergonomists or not only occupational doctor, but a lot of people with the same aim, with the same philosophy and approach. That's important.
Okay, that's it. Thank you very much.
Thank you very much.
Thank you.